My name is Carol Mathews, and I am the chair of the Department of Psychiatry at UF and the director of the Center for OCD, Anxiety, and Related Disorders. Hoarding is a psychiatric illness, which a lot of people don't know, and it's more than just clutter, which is what people think about. Hoarding is really about difficulty discarding things, difficulty letting go of items that you may not need or that you have too many of. What that leads to is clutter and accumulation of items in the home, which can then lead to difficulty in functioning. So if your house is full of items that are unneeded, you can have pest infestations, you can have difficulty using your kitchen or your bathroom or your bed or your desk. We screen everybody who comes into our OCD clinic for hoarding because it's much more common in people with OCD and depression. But we're also now starting to ask geriatric physicians to start screening their older adults for hoarding. We did a study recently, an online registry sample of about 70,000 older adults, where we found that 10% of them had hoarding symptoms that were significant enough that I would screen them further. Now, the population prevalence of hoarding is probably about 4%, but it gets higher as you get older. So we've started working on ways to get more screening into the kind of general clinics. So I think for me, the really important part is that hoarding is an illness. It's not something that people have control over. It's not a bad habit, and it is something that's treatable. Hoarding is unfortunately really poorly understood. There's a lot of social media, public media out there that dramatizes hoarding and makes it look very extreme, and there are extreme cases. But there are also a lot of people who are just living everyday lives who suffer from hoarding symptoms, who don't know that they have hoarding and could benefit from treatment or even just recognition of what it is.